rahmatullahi ta'ala wa barakatuh. I'm Anas Khani, I'm Dr. Anas Khani, and I welcome you from the Saudi 2 studios. Today will be our last episode, and in this episode we chose to talk about infectious diseases and specifically coronavirus, since now we are in the Eid period, and I wish all of you a happy Eid and Eid Mubarak with your families. Since we are in the Eid period and we know that we go to a lot of crowded areas, we get invited, and we get with everyone we know. So how can we limit the spread of corona, and how can we prevent the coronavirus from reaching us, and how can we deal with it in a correct way? That's why here with me we have Dr. Mazen Barry. Dr. Mazen Barry is consultant of infectious diseases. Welcome to the studio with us, Dr. Mazen.
Thank you, Anas.
Dr. Mazen, as you heard the introduction, we said that we all know now we are in the Eid period and everyone get invited and it's all crowded all over the place. And we keep hearing in the media about coronavirus, how we should go along with this prevention and etc. Can you tell us a small introduction about what's coronavirus and what causes the symptoms of coronavirus in general due to the virus?
Right. Coronavirus is a well-known virus that has been causing human disease for a very long time. There are several types of coronaviruses that usually causes just your normal common cold, sometimes a bit of a pneumonia or a bronchitis. It became famously known back in 2003 during the SARS pandemic that hit Hong Kong and then spread throughout the world, and which infected about 8,000 people, mostly in China. Second country affected was Canada. There weren't any cases here in Saudi Arabia, fortunately. And ever since then, the coronavirus has been well known to cause these sudden outbreaks that cause quite a big panic in the world. And as fast as the SARS virus appeared back in 2000, it was the end of 2002. By the end of 2003, it completely disappeared, never to be seen again. And about almost 10 years later, this new coronavirus emerged here in the Arabian Peninsula, which is a new coronavirus, which is closely related genetically to the SARS coronavirus. And this coronavirus has been named the Middle East Respiratory Syndrome coronavirus, or MERS coronavirus for short. And the first cases were documented in September of 2012, and we all know what happened since then throughout the past few months.
Dr. Mazen, I would like to ask you an important question probably all of the audience are concerned about. We keep hearing now in the media and in the radios everywhere on TVs about coronavirus, and is that we have some good news that it's limited somehow now in the kingdom and it's almost under control. Can you tell us from your experience what are the new statistics from the Ministry of Health and from your expertise, how the statistics are going now after we started a plan in the kingdom to limit the spread of corona?
Right, so as of the day of the recording of this episode, which is the 18th of July, there has been 703 cases throughout the Kingdom of Saudi Arabia. Around 1/3 of them had, unfortunately, fatalities. May God mercy on their souls. But however, the big and the chunk of the numbers happened during the month of April of 2014 and May of 2014, after the intervention of the Ministry of Health and the rapid response through the Central Command Center. There has been a rapid decline in the number of cases throughout the kingdom. Currently, if we compare the number of daily cases that we're seeing these days, the days in which this recording is being done, in comparison to exactly 2 months ago, there is probably a more than 80% drop in the cases. There are several days in which we have no new cases in the kingdom, which is very nice. And we look at what we call something the epidemiological curve, in which we see the number of cases per day, then per week, per month. And if we compare this week with a few weeks ago, you would see that the number has dropped by more than 90%. So there is a dramatic drop in the number of cases that we're seeing daily. and that's basically because of proper infection control within hospitals.
And that's probably very good news to hear and to tell the audience about, is that thanks to the rapid response, as you said, Doctor, from the Ministry of Health and from the officials here, we have a very good and rapid response and decrease in the amounts of coronavirus infections and cases.
Absolutely. Yeah.
Definitely.
I hope by the time this is aired, this will still be true.
Inshallah, definitely. Inshallah, it will be by that time probably a 90% drop or 95, inshallah.
We sure hope so.
Doctor, that brings us to the next question. How everyone keeps hearing corona, and we see some people covering their mouths with the masks, and they are trying to not to go to the malls. And as you know, probably you know more than I do, since you have plenty of patients coming to your clinic from your expertise. But can we tell the patients how it's transmitted, the coronavirus, and how correctly they can prevent having this transmission?
Right. We believe there are several ways in which somebody could contract the MERS coronavirus, basically being in contact with somebody who is sick with the coronavirus. So first of all, you need to know what are the symptoms. So the symptoms of the coronavirus are pretty similar to your normal, almost similar to any flu-like illness, any common cold. So it could be basically just a fever, with a cough, with a runny nose, upper respiratory tract infection. In more severe cases, you would develop shortness of breath, pleuritic chest pain, which basically indicates that the patient might have an underlying pneumonia. So it's in contact with people who have these what we call a febrile respiratory illness, in which the virus could be transmitted by either their droplets, meaning when the person who is carrying the virus is coughing or sneezing, the droplets that are suspended in the air that could travel about within a meter around the patient with the virus. The other person that's near to this infected person could easily inhale this virus and catches it by that means. Also, if there's direct contact by, let's say, by shaking your hands with somebody who has the virus, in which somebody might have cleaned their nose and they had the virus and they didn't wash their hands, and then they would come and shake your hands, you could contract the virus by direct touch. Or if somebody who had the virus, for instance, was sneezed and then, let's say, just touched this table and then left in the restaurant, and then somebody else came and this wasn't cleaned properly, and you sit down and you touch the surface, you could get the virus in your hands. And there is some preliminary data that show that this virus could be also transmitted through what we call airborne route, in which it's transmitted even further than just the 1 meter diameter of droplets. But this is still, as of today, not 100% confirmed. But however, we are dealing with it in the hospitals as if it is airborne. It's important to note that most of the cases, or not most of it, but quite a big chunk of the cases have been nosocomial, or what we call hospital-acquired infections, in which the infections happened in hospitals. So
from medical staff.
Either from one medical staff, from a patient to a medical staff, or the other way around, from one patient in the hospital to another patient who came to the hospital for another reason, and then he contracts the virus from that patient. This has initially happened in the initial cases in the initial clusters that happened in different parts of the kingdom. And the reason for that was the poor infection control. There would be, for instance, overcrowding in the emergency room. There would be one patient sitting in a bed, and there's not even a 1 meter gap between one bed and the second bed. The standard is to have at least 3 meters between each bed. Literally, there are doctors who describe in the infected hospitals, the doctors would describe that to go from one patient to the other, they would actually have to jump from one bed over to the other. It's that busy, it's that crowded. Unfortunately, this is a bad situation. It's a disaster waiting to happen when you have this overcrowding within this hospital. So the hospital administrations would think that they're doing the community a favor by having more beds available for people to come in and get treatment, but unfortunately it has a negative effect from an infection control perspective, because you will, with this very crowded and tightness, you would have just, it would be so easy for the virus to jump from one person to the other, and this is the reason why we saw a lot of cases. And now that this has been under control and that it is no longer being practiced in all of the hospitals, everyone's under good infection, all hospitals are practicing good infection control. This is probably the reason why we saw the dramatic drop in the cases.
Definitely. And now we will stop with this report, and then we'll come back to the studio with Dr. Mazen to talk about, again, coronavirus. Stay tuned with us.
Infectious diseases are disorders caused by organisms such as bacteria, viruses, fungi, or parasites. Many organisms live in or on our bodies. They are normally harmless or even helpful, but some organisms under certain conditions may cause disease. Some infectious diseases can be passed from person to person.
Infectious diseases are the group of diseases which move from person to another person by contacting or touching either each other, or which move from animal to a human person. Infectious diseases are divided for many sections. We have respiratory infectious diseases which contain flu, influenza, or contain bronchitis, or contain tonsillitis, nasopharyngitis, or there is another section which in gastrointestinal tract, the most important one is the gastroenteritis, which come from food. And we have skin infectious diseases which contain most important urticaric or cellulitis, or contain furunculosis, or some infectious diseases which come from swimming pools, just like pityriasis rosea, or versicolor pityriasis, or even skin infectious unspecific.
It may seem a daunting task to keep yourself and your loved ones free of infections, beyond the obvious steering clear of running noses and hacking coughs. You may be wondering about some other practical ways of staying infection-free. Your skin attacks as a natural barriers against harmful microbes that caused infections. But smart bugs have found other ways to get into your body and cause infection.
I advise all people, especially during Ramadan and Eid and these events which crowded, I advise them to keep on hygiene, their personal hygiene, by washing hands, washing face every day, and even when they are in crowded social situations, they put facial mask. It's very important, especially in religious society for these days. Also, I advise them not to put their hands on their mouths or their eyes without using tissues. It's very important for preventing these infectious diseases. Another thing, I advise them to control their food, especially in Ramadan and in Eid. You know, there is many kinds of food in every house. So I advise them to control their food, not to eat many kinds of food, and even especially for people who are traveling in vacations, try not to eat very much in restaurants or junk foods, and try to keep on eating from the homemade food which they prepare by their hand.
Staying on the safe side and to prevent the spread of many infectious diseases, washing hands fluently would be a good tip. Not sharing personal items with others, covering mouth while coughing or sneezing, getting vaccinated, using safe cooking practices, and finally, exercising caution with animals. Infectious diseases are spreading around the world dramatically, so protecting yourself and your family is your responsibility by using all the ways that you have. For the Health Show, this is Nida Ode, KSA2, Dubai.
Welcome back, ladies and gentlemen, back in the Health Show with our guest here, Dr. Mazen Berri. Dr. Mazen, we were discussing coronavirus, and we talked about how it's transmitted, and we said that until now it's either by direct contact or by droplets. As we said, within 1 meter someone sneezing and then we get it. Can we now just may I ask you a question about the incubation, as we call it, period, or the period at which the virus stay in the body until the symptoms show up?
Right. So it's believed that the incubation period is between 1 to 14 days maximum. Average about 3 to 4 days is the usual, but it could happen after even 14 days after being in contact with somebody who's infected with the virus. And it's important to note that the disease due to MERS coronavirus has a wide spectrum of disease. So it could cause a very mild cold kind of illness, all the way to a very severe bad pneumonia that requires people to go to the intensive care unit and get intubated and get ventilatory support.
Doctor, may I interrupt you? When we say pneumonia, just for the public,
right?
Can we just clarify more on that?
So pneumonia is basically the infection of the lung tissue. The actual tissues of lung gets infected with the virus. So the common symptoms would be like a severe cough, probably some phlegm or sputum or production with it. Chest pain, especially when you take a deep breath, and difficulty breathing and grasping for oxygen. These are your classic symptoms of pneumonia. And all the doctor needs to do is do a chest X-ray, and that's easily diagnosed and picked up.
A pneumonia. Doctor, that brings us to the next question, which is the environmental factors. As we all know, and as you from your experience, there are, to all viruses and bacteria, there is environmental factors which help in developing or the growth of this virus or pathogen. Can you please tell us, specifically to coronavirus, what are the specific environmental factors that help in the growth of this virus and the spread of it?
Right. So basically, so there's probably two different aspects. The one aspect is the relationship in which has been documented between the coronavirus, the MERS, this particular MERS coronavirus, and the Arabian camels. So perhaps the contact with camels who seem to be carrying this virus for a long time might be a source of infection. This is still preliminary, but we do have some published data in the medical literature and some good studies that showed a good link between a number of human cases and the Arabian camels who actually had some symptoms of a cold. So probably avoiding contact with camels during this period until this MERS coronavirus is completely obliterated would be a reasonable thing to do. The other thing is basically the understanding of how to avoid contact with people who have a cold or a flu-like illness. So it's important for people who have the cold or who have a flu-like illness. So if you have a mild disease, it might be coronavirus, but you're not sick enough to require going to the doctor. But you might cough or sneeze or give it to somebody who, let's say, is an older person who has diabetes or a chronic illness, who will get very sick with it. So it's your responsibility to cover your cough and to prevent the spread of the virus. So for instance, you wouldn't cover your cough with your hands and then go shake other people's hands. So the proper way is either to use a handkerchief, and if you use a handkerchief, immediately dispose of it in the garbage. Or you could, if you don't have a handkerchief, then you could use the sleeve of your elbow and cover it like this when you cough. And unfortunately, we see a lot of waste and garbage disposal in the streets, in the malls, even in the public, and even in the hospital. In the hospital, you see a tissue lying here, lying there. So this is the mean of spreading the virus. If we all take the time to properly dispose of our waste in the proper way, we would really, this would dramatically control the spread of the virus. And same thing with covering our cough in the proper way, washing our hands vigilantly, always wash your hands. So just going back to the basics, just
exactly,
to being clean and
hygiene,
good hygiene.
basics.
Absolutely.
Okay, doctor, during our discussion and just now when you answered my previous question, you mentioned two things that popped up into my mind.
Right.
The first thing is that some patients, they do have the virus, but it's not severe enough. That means not everyone who got corona, probably they will suffer severe consequences, isn't it?
Absolutely.
So what are the next follow-up question is which patient groups that are at risk of developing severe infection?
So from looking at the data that we have on all the patients who have been infected with the virus, it seems that people with chronic diseases like people with diabetes, heart disease, chronic lung disease, those with immunosuppression or cancer patients, they seem to be more prone to get a more severe disease and requiring admission to the intensive care unit, and even the mortality rate seems to be higher. That doesn't mean that it doesn't happen to your normal healthy person, but the trend seems to be more towards these kind of individuals, which is expected with most pathogens. When the disease strikes, it could cause you, as I said, a normal common cold sometimes. So you really do not need to seek medical attention. You just probably isolate yourself by wearing a mask when you're with your family. Don't go out. Wash your hands. Cover your cough to make sure that you don't spread it in the community. The people who should seek medical attention are those who develop severe symptoms, like the severe cough with sputum, perhaps some blood in it, again with the chest pain, with shortness of breath, difficulty breathing, grasping for air. So the symptoms of pneumonia, these are the people who, if you get that, then you should immediately go seek medical attention.
That's definitely true, and I stressed on this point, doctor, because we keep watching people, they are panicking from coronavirus, and I even know some of my extended relatives or friends, they isolate themselves within their homes as if it's a totally endemic disease, although it's not, and the Ministry of Health, as you said, they are taking rapid actions to limit it. So hearing this from you will definitely give us a head up that it is not a fatal disease as long as you take the precautions and make sure that everything is going as it should be from a medical point of view.
Absolutely. And it's always, so it's good that the public be aware of the virus. So Channel 2 is playing a great role by doing this interview to increase the public awareness. I personally did a lecture to my kids' school, to all the kids, to educate them and never keep our guard down. So we're doing currently these days a campaign in King Saud University against for awareness about the coronavirus. So we need to, even though the number of cases are going down currently, but we need to always be vigilant. We all need to continue the education on proper infection precautions, proper cough etiquette, proper hand hygiene to prevent this from ever happening again.
And now we will stop with this report and we will get back to you, ladies and gentlemen. Stay tuned with us.
Case of the coronavirus being found in northern England, many people want to know more about this potentially fatal virus. The coronavirus is a large group of viruses that affect the respiratory system. Patients have presented with fever, coughs, and breathing difficulties. It causes pneumonia and sometimes kidney failure. The human coronavirus was identified in the mid-1960s, and cases have risen since then. Contrary to popular belief, the virus isn't linked to the popular lager brand. It is in fact named because of the crown-like projection on the surface of the virus. Coronaviruses are very fragile, as they only survive outside the body for around 24 hours. The viruses are also easily destroyed by household detergents and cleaning products. Despite this, the virus can be lethal, and out of the 10 reported cases, 5 have been fatal. As with other respiratory infections, the coronaviruses are spread through the air. When an infected person coughs or sneezes, tiny droplets containing the virus become airborne and can be inhaled by someone nearby. To avoid catching or spreading any viruses, make sure to follow the Catch It, Bin It, Kill It campaign. Cough or sneeze into a tissue, then bin it to kill the virus.
Welcome back, ladies and gentlemen, and back here in the health show with me, Dr. Mazen, a consultant of infectious disease. Dr. Mazen, we already discussed the most important points about coronavirus, how it's transmitted and its incubation period. And now we come on to the next question is since the audience are hearing us, and since we said that we need to increase public awareness, when should a patient or an infected person with a flu who is having common flu symptoms should visit a doctor and should be worried that he should seek medical attention and it might be corona or not?
Right, so it's, as I've mentioned previously, only if you have the symptoms of the pneumonia, the severe symptoms, this is when you should seek medical attention. If it's because the coronavirus, as well as all other common cold viruses and respiratory viruses, could cause a mild disease that does not require you to go to the hospital. So if you're just having a mild illness, then I wouldn't even go to the hospital. It's only if you develop the cough, the high-grade fever, shortness of breath, difficulty breathing, the chest pain, that you should seek medical attention.
So probably, as you mentioned, if we have just the severe symptoms, I would highlight again the fever, the high-grade fever, which is probably around 39 to 40 degrees.
It could be 38.5.
Okay, but it should be probably persistent for
probably a fever that will cause you to be quite tired and fatigued and loss of your energy.
Yeah.
If you feel in general that you're really drained out, so not your normal cold in which you could still function. If you feel that it's really dragging you down and you're getting a lot of breathing problems, then that would be a good time to see your doctor.
And also the chest pain, the severe cough, if we're having any blood with the cough, this is definitely red flags or alarming symptoms that we should seek.
That's the right word.
That we should seek medical attention. Okay, and that brings us to the next question, doctor. Although you've said already or discussed this point during our discussion, the prevention, but we need just to stress more on it since we're trying to increase the public awareness about this. How can we prevent the spread, and when should we speak up about if we're suspecting coronavirus or not?
Right. So again, prevention is that it would be just good practice of hand hygiene and covering your cough. So there isn't any current medication, there isn't any current vaccination to prevent us from getting the disease. So the key here is just to go to the back to the basics. It's just like all the pandemics in history were always related to poor hygiene and sanitation. So if we are able to at least use good hygiene and sanitation as our defense, then we should do that. So people who have cough should cover their cough properly and wash their hands. If you're sick, then stay home. If you must leave the home, then wear a mask. Since it's the Eid period these days, if you're having a cough or a cold or a fever, then you should you should not visit your relatives and friends. You should not mingle, even if we don't know if it's corona or not. It would be always a good idea if you have a flu-like illness or a cold, not to mingle with anyone.
And doctor, since we mentioned camels, I heard, I'm not pretty sure if this is true or not, I heard that even drinking raw camel milk might be a cause of spreading the infection. Is that true, or is it?
Right. So that is probably true. How true it is, it's just some from limited data in which in which a particular paper has showed that they were able to isolate the genetic material of the virus within the milk of the Arabian camels. So that's probably true, and I wouldn't advise anyone to drink raw milk regardless whether there's coronavirus or not, because of the widespread of other diseases, particularly brucellosis. That's quite pandemic in our kingdom, and the main route of transmission of brucellosis is through the use of raw milk.
Raw milk, definitely. And doctor, since we talked about everything almost now, may I ask you this question? Is there any ongoing research about vaccinations for the coronavirus?
Yeah, so good question. So since the discovery of the coronaviruses, which was back in the 1960s, and especially after the SARS outbreak that happened 10 years ago, there has been a lot of extensive research looking for a vaccination for the coronavirus. So it doesn't seem likely that there ever will be a vaccine for this particular virus. If a vaccine agent will be available one day, it will probably be available for animals rather than human beings. Whether we will be interested in vaccinating our camels, that's a different issue.
Definitely. And then now we will go to this report and we'll come back with you, Dr. Mazen, to conclude our episode. Stay tuned with us, ladies and gentlemen.
Viruses, bacteria, microorganisms. You hear those words and you think about coughing, sneezing, getting sick. It's true. Germs can be our enemies. Beginning in the 19th century, when germ theory was first proposed, we drew battle lines between us, the afflicted hosts, and them, the invading species. And then we identified which diseases are associated with which microbes and develop ways to defend ourselves against them through immunization, through sanitation, and through better living conditions. But today, scientists recognize that there's a need for a more ecological view of the microbial world around us. Microbes and their hosts depend upon each other for survival. Sure, the scene stealers are the germs that make us sick. They get all the attention and they give all the other microbes a bad rap. But the fact is, most microbes don't cause illness. In fact, many of them protect us. They help our body function properly, and they battle with the harmful organisms in this constant conflict for habitable space in our body.
So in the beginning, it was all microbial. Then our ancestors arose and came along, and we evolved from them, and we evolved in a microbial world.
Well, microbes are in us, on us, and all around us, all the time.
In fact, our bodies contain at least 10 times as many bacterial cells as human cells, which blurs the line between where microbes end and humans begin.
Virus absolutely requires another cell for its growth, and it does not carry the machinery that it needs for its own replication. It is not independent.
Bacteria, on the other hand, are much larger. They're single-cell organisms. They can live in the environment and replicate in the environment, and some of them, the bad ones, can gain access to the body, infect us.
Eukaryotes are complex cellular life forms. They have internal structures. And of those eukaryotes that cause disease, we have fungi, and then we have some worms and some protozoa. And those are the major classes of disease-causing organisms.
Microbes have inhabited the Earth for billions of years. They occupy every conceivable ecological niche. They're in the water, they're in dirt, they're in the air, they're in plants, rocks, animals. They're everywhere. They even occupy the Earth's most extreme environments. In fact, by mass alone, microbes are the most abundant life form on the planet, and they're highly adaptable to changing environments.
Microbes are truly clever. They have thousands of solutions to problems we haven't even thought about because they've encountered them already.
A handful of deadly diseases claims millions of lives every year. HIV/AIDS, tuberculosis, malaria, diarrheal diseases, lower respiratory tract infections. Together they account for 1/5 of global deaths annually. And scientists continually monitor influenza outbreaks.
Influenza has a history with us that we can point to. It was the cause of the largest amount of infectious disease death in humans this last century.
Migrating aquatic birds are the original source of all flu strains. The virus spreads when droplets from a sneeze or a cough from an infected person comes in contact with someone else. But there are other ways for diseases to spread as well.
We've had a number of experiences with so-called cross-species transmission of microbes spreading from animals to people, sometimes directly, sometimes via an insect vector, so that people can acquire an infection in a faraway place and even before they're ill, be home.
We know that there are things that you can do to protect yourself against infections. Immunizations are critical to protection against influenza and other infections. Every public health official will tell you to wash your hands thoroughly with soap and water, and cover your mouth, cover your nose when you cough or sneeze. And to thoroughly cook your meat, your poultry, and your eggs to avoid foodborne illnesses.
Welcome back, ladies and gentlemen. I'm Dr.Anas Khani, and we are here at the Health Show. And with me here, Dr. Mazen Barry, consultant of infectious diseases. Dr. Mazen, we pretty much discussed everything about corona, and now we come to conclude our episode. Just can you tell us briefly what are the most important recommendations, general recommendations that you would like to give to the Saudi 2 channel and to the Saudi public in order to increase awareness and prevent the spread of corona?
Right. My basic advice would be there's two aspects to the disease. One related to the hospitals, one related to the community. So for hospitals, I think the stressing out on proper infection isolation, preventing overcrowding in the hospitals, identifying and triaging patients with febrile respiratory illness and isolating them immediately, starting them on proper contact droplet or even airborne precautions as soon as the patients come into the hospital to prevent further transmission within the hospital to other patients as well as to other healthcare workers. The other important point would be in the community. So in the community prevention of disease would be again back to the basics, sticking with proper hand hygiene, cough etiquette, covering your cough, and people who have even the mildest febrile illness or a cold should try to prevent mingling or mixing with other people, because they might feel fine themselves, just have a simple fever and a cold, but it's not really bothering them. But you should think of your grandfather who has diabetes. You should think of your uncle who has chronic kidney
the risk
disease.
Groups we mentioned.
Yeah, that you eventually, even if you didn't have somebody in your relatives who has that, but you might give it to your brother, and your brother's brother-in-law, for instance, has chronic kidney disease, and he'll pass it to him.
Definitely.
So it's just, you have to break the chain of the infection.
And that's how we can prevent the spread of this virus. Thank you very much, Dr. Mazen Barry. I would like to thank you for being here with us. It was an honor having you with us. Thank you very much for being here.
Thank you for having me.
And from here, ladies and gentlemen, I would like to thank you all for being with us in this program. This is our last episode, and this is our sixth and last episode. I would like to thank you all, thank the audience. I would like to thank the backroom staff, Director Mr. Badr Al-Anazi, Ghadir Rashid, Fawaz Rassayis, Salman Shabib, Bandar Al-Ataibi, Nasser Al-Bishi, and Badr Bukhari. And also I would like to thank my seniors, Dr. Ahmed Al-Khani, Dr. Fuad Liafi, Dr. Ahmed Turko, our nutritionist, Dr. Razan Duqmaq, and all other consultants and guests and other medical experts who were along with us in this program. Also, I would like to thank the institutions which helped us in the program, including KSU University Hospital and King Saud University, Kingdom Hospital, King Faisal Specialist Hospital, Al Faisal University, and all medical doctors and students who participated with us. Also, I would like to thank definitely Ajmal Medical Center and my family and friends. Definitely a special thank to my family for supporting me, everyone who participated and supported and helped to make this program successful. Thank you very much, ladies and gentlemen. It was an honor hosting this program. I would like to wish you a happy Eid with your families. See you soon, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. This was Dr. Anas Al-Khani. Thank you.